That's the plan. I don't know if it works, but we'll see. When you want the truth about something, anything, you don't Google it. You go out there, talk to the people living it, and see for yourself. And this is what I did for the entire 2025, spending almost a year across Scandinavia, discovering facts from people in many different fields, observing things around the places I've been to, and understanding many aspects of my presence here on YouTube. From defining the project that I have in mind, since yes, at the very beginning the focus pointed in another direction, to comprehending some key factors about this platform. During my journey, I collected more than 100 interviews. Now, I think it's time to take a stock of everything I've learned from this experience and share it with you. It was early February and there was an icy wind, but I was standing with a cardboard outside the Faculty of Medicine in Aalborg, because I was curious to learn more about healthcare in Denmark. I didn't have the chance to interview any doctors or nurses, so I decided to challenge fate in front of the university. Hi.
Hey.
It's for my YouTube channel, if you want.
Oh, no.
I don't know if you study medicine or just simply...
No, I'm a teacher and I have a...
Oh, way much better.
How long are you staying here? Because I actually have a meeting, I think in about 1.5 hours.
And spoiler, I never saw her again. But at some point... Hi guys, it's for a YouTube project, if you wanna have some 2 minutes chat.
2 minutes?
Yeah?
Yeah, sure.
If you wanna.
Where, inside or?
Whatever you want, I mean...
Then let's go.
Okay. You are extremely lucky to have, okay, you have to pay more taxes rather than any other part in this in Europe, but you have the best quality of services. Okay, technically not true at all. As you can see from this list, Finland won the prize for the highest personal income tax rate in Europe, but well, Denmark is pretty close to the top, so... But at some point I heard that, okay, there could be some type of problems.
Yeah, Danish healthcare is good in some fields, but in other fields it's lacking a lot. And that field that we're in, for example, we're working a lot with psychiatry.
Okay.
So something that we're doing right now is that we're actually studying for biomarkers in patients with some form of mental illness, because that's something that we see as lacking. And to be honest, there hasn't been a lot of research that we are aware of here in Denmark about it. Okay. But that's another kind of issue. The other issue is that there's just not enough money in the business, in psychiatry. So, okay, you get paid a lot as a psychiatrist, but on the other hand, it's there's a lot of work to do, because there are people who comes in all the time with new form of diseases, and people who has milder form of mental illnesses. For example, a form of depression or anxiety. They cannot get into the psychiatry just like this. It's going to take years before they get in. Especially up here in the north.
And yes, by the way, Aalborg is actually the northernmost city of Denmark among the bigger ones.
Because it's mostly public services, where in Copenhagen you can find a lot of private psychiatrists, but you have to pay for it. So on that matter, there are some fields where they're just lacking people because there simply isn't enough money. And the other problem, as you beautifully mentioned, is also that nurses has been out protesting a lot the last couple of years. And that's about the salary, that they don't get paid enough for the work that they do. To be honest, I don't know where...
Just nurses or also doctors?
I don't know about doctors, but I've seen a lot with nurses. Doctors usually, when they're done with their education, they start with the same salary as a regular nurse, and then it increases over time. But for nurses, I've seen the thing a lot, and that is kind of an issue, because they're actually doing a lot of work. And that also has to be taken care of, right?
I know that here in Denmark there's like a lack of people studying to be a doctor, and especially nurses, because of how the nurses and doctors are treated with their paychecks and what they earn. And I feel like that's most of the reasons why many people can't don't want to be doctors. It's because of how the paychecks aren't really adding up time and hours they're putting into the work. Yeah.
But you are studying to be a doctor?
Yes.
Yes. And you, even if you said this to me, you are, no,
Yeah.
you want to continue this
Yes.
type of career, no?
I feel like for doctors to have a better paycheck, there needs to be more doctors out there to do
Okay.
the work.
So you're hoping
Because-
for the future?
Yeah, I hope
Okay.
for the future that this system will add up again. Because at the time, the doctors, there were enough doctors and people weren't like going off to Norway to be doctors over there.
On paper, nurses in Denmark are well paid compared to the most of Europe. So why the constant narrative of low pay and people leaving for Norway? Because low pay in Denmark is relative, not absolute. Nurses compare themselves to other Danish public sector professions with similar education and responsibility, where they have historically been placed lower in the pay hierarchy. And Denmark's rigid collective bargaining system makes fixing that gap very difficult. At the same time, staff shortages have increased workload, stress, and burnout. When pressure rises, even a good salary stops feeling enough. Norway then becomes the easy alternative, close, familiar, and better compensated. So it's not just about money. It's about relative pay, system rigidity, and working condition, all combined. And I heard that, for example, here you experienced something a little bit similar with Norway.
Oh yeah.
Based on the fact that they paid more. I don't know.
And there's less competition.
So less
Norway
competition.
is a really large country with a lot of resources, but not that many people. To my interpretation, I would always say that Norway is beyond Denmark when it comes to salaries, when it comes to, in general, the life there. There's not as many people that are competing with each other like here. When we started here in university, there were almost 300 pupils at medicine school, where half of them are gone now. But in Norway, I don't know exactly how it is, but I guess it's not the exact same number as here. Because it is less dense there. It's a large country. But the one big city, 2-3 big cities they have is Oslo, they have Bergen, and they have Stavanger, maybe some others. But these are the largest cities, and that is where most of the competition is. But large country with not that many people means there's more opportunities often in general. So yeah, it is kind of a problem in some ways that there always has to come some new doctors they have to take from foreign countries also, because many doesn't want to go into some form of special field in medicine, so they have to get foreigners. But the Danish government keep talking about that they want people from Denmark to come and educate themselves. Yeah,
exactly. That's the point. You said before that in Copenhagen, for example, it's quite different because they have a lot of opportunities if you want to explore the private sector. Here it's not the same.
There are some private sectors, but it's just not in the same degree as you see in Copenhagen, where there are so many. So the other problem is that a normal doctor, like an AP, can prescribe the medicine to you if you need something, for example, for ADHD, depression, whatever it could be, but you have to be at least 25. But a lot of these diagnoses, you see them coming before. So what do you do with these patients that are just having some form of disease and it cannot get treated? They have to wait years before they get into...
If you don't have the possibility to wait, you have to be relocated, let's say, to another hospital? No. Is it possible, or...?
Is it?
Yes.
I don't know.
Yeah,
maybe you can...
It is?
It's possible to get relocated. So let's say that you have a surgery that you need to do in 6 months. Then first they will try to do it in a public hospital in Denmark. So that would either be in Aalborg, Aarhus, Odense, or Copenhagen. But then beyond that, if you can't get a time and you have to do the surgery, then the government is actually responsible for paying the private sector to do the surgery. So in that sense,
yeah, okay.
you can get transferred if
But-
the public sector
But that
can
is
provide.
but that is for surgery.
Yeah, but I mean, it's also for treatment. If you can't get a neurologist, and you
We're
need a
I was
neurologist.
thinking in terms of psychiatry.
Yeah,
yeah, if we're talking the bigger image-
psychiatry. No, I mean that's mostly handled by the public sector.
Denmark is often ranked among the world's happiest countries, yet mental health is a growing pressure point, and a big part of the paradox is structural. Psychiatric care in Denmark is primarily a public responsibility run by the regions, with a relatively limited private sector to absorb excess demand. That means when demand rises, waiting times and access bottlenecks become highly visible, even in a high-tax welfare state. I highlighted the suicide rate because in 1980s, Denmark was among the countries with the highest suicide rate in the world. Young people are the center of the debate. It's particularly striking to see that young people of different age groups all report very similar levels of feeling low. Denmark has acknowledged increasing mental health problem among youth and has introduced reforms and new rights aimed at faster treatment, but the system has struggled with capacity for years. We can see this reflected in how frequently these issues appear in political debates, and in the number of politicians who have made mental health a central part of their agenda. And during 2025, a major investment plan in mental health was presented. And only recently, this reform was formally approved, providing increased support for young people under the age of 25. So the happy country image can be true on average, while many individuals still face real barriers, such as long queues, strict prioritization, and limited alternatives outside the public system.
I would say in general, the Danish system, healthcare system, depends a lot on who you are. If you are a minority, like us, for instance, and you can't speak the language, then in many cases you'll just get thrown around. If there's nobody to help you in the system. So they will throw you around until something happens, or you meet a doctor that is nice enough. But I know many cases, especially for minorities, in psychiatry or in any other cases where people have been thrown around and nothing has basically happened.
Okay.
So that's a very important point. I mean, that's something that if you are coming to Denmark, let's say, and you want to work here, if you can speak English well and you are from a European system or an American system, then you're gonna have an easier time in general. Okay. If you are from another background, let's say African or Middle Eastern or so on, then you're gonna have a much harder time.
What's your plan for the future? I mean, I saw that behind this university there is a new hospital, but everything is still in construction. I mean, probably it's just a little part of the entire building.
Yeah, it is.
And so I don't know in how many years everything could be, completed. If you know, I don't know. And if you see your future at some point here, not in that hospital, of course, I don't know, but here in Aalborg, or no?
About the hospital, it's been ongoing for 12, 13 years? Or
no, 4 years, for 5 years.
Only 5 years?
5? Okay.
Really? No.
Yes, 4 or 5 years.
Okay then.
Yeah.
Oh, that's not so bad then.
The new Aalborg University Hospital has become a symbol of Denmark's Superhospital strategy and also of its challenges. Originally planned to open much earlier, the hospital has faced years of delays, with the timeline now pointing to mid-2026. Problems reported include construction defects, water damage, technical complexity, and budget overruns. And it's not the only one. In fact, in another region of Denmark, they have the same type of issues.
That's because it's the new hospital.
It's the new one. Okay.
Another one more into the city. So that's the new one.
Mm-hmm.
And they're gonna switch to that when it's done.
Just switch it, not just implement.
At first they're gonna use both.
Okay.
But I feel like it's gonna be that one over there that people are going to study at.
Okay.
Yeah.
Okay. And you are just, have the chance to work there?
You have the chance to do nurse kind of stuff when you're studying, but you can't, of course, go over there and be a doctor right now. But you can take a course and you can go to exams to be nurse and take like shifts other people when they are missing.
Yeah, sure.
Staff. But that's also because people are really in the lack of staff right now. You can do it right when you start. Sign up for the course and you can go to the exam and finish the course in like a month or something, month or two, and then you can start.
Aalborg's new hospital is part of a national policy to replace many smaller hospitals with fewer, larger superhospitals, designed to centralize acute care, advanced treatment, and medical research. Supporters argue this improves quality, specialization, and efficiency, while critics point to delays, rising costs, and longer travel distances for patients.
But our plan, or my plan, is now next year I'll start on, actually this year in the summer I'll start on my master, and then the thing we want to do, as we talked about before, was find these biomarkers in patients with some form of mental illness, and that's what we want to continue our work on. So we want to do research together. He's doing a lot of coding, and he's doing nanophysics, so he can also implement a lot of IT into what we're doing. And he also has a lot of knowledge about psychiatry that he's actually helping me with too.
Yeah.
So hopefully we can set up a research station here, because that's something that's lacking here in Aalborg. You can find in Aarhus. I don't know about Copenhagen, but I guess so. So hopefully we can set up a neuropsychiatry station right here with a research team where we can do form scans like MR scans and imaging in general, so we can find biomarkers. And that, then I would like to get into the psychiatry too. And I know I speak a lot negative about the psychiatry. But I really want to come in and see how it is there, see how it actually is, because now it's everything I say is based on what I've heard from others and what I read.
But you have to experience everything.
Exactly, the personal experience is the most important. So that's my plan.
But your plan is consisting in not going outside the country.
I have thought about maybe moving to Germany.
But just because it's something based on your desire, not because you know that, okay, that state could represent a better solution for me for that specific reason.
No, it's actually on purpose. And the reason I thought about Germany, it's not a plan at all. It was just brainstorming. It's because the possibility for research is much better over there. There's much more research ongoing across borders than there is here in Denmark. Denmark is good in research, but there are countries here in Europe that are just far beyond Denmark. And Germany is really close, and there's just much more there. But there also has some downsides. Like there's much more bureaucracy and hierarchy there, so you have to follow up on. So high-level doctors what is an OLA called in English?
Consultant surgeon.
Would have much more
physician,
power and in general taking all the decisions. So you would not be able to take as many decisions yourself as you would here. You don't have as much freedom there as you have here. So there's also some downsides to that plan, but it was just something I'm thinking about. But for now, the plan is to stay here.
Okay, cool, cool. You as well?
Yeah, I mean that's here's where I see my future. Hopefully in Aalborg or in the northern part of Denmark. So I'm in my last year of masters. So this is my last semester in university. So I'm hoping to get a research scholarship here in Aalborg, and I also have had offers from the US and other places to do research, but I want to stay here because my family's here, and I like the general work ethic and the system here, because the system is not hierarchical. So I work also on the other side of the road in Novo Nordisk, I'm sure you've
Oh,
heard
yeah,
about
yeah.
them.
Got it.
I work in the research and development department, and I mean, I don't. Although I'm a student and somebody who's like the let's say the vice president of our department who has like 1,000 employees or 2,000 employees working under him, I can very easily book a meeting with him and meet up with him online.
Okay.
And there's no kind of hierarchy. So that's really what I like with the Danish system, that we can just, if we have an idea, we can go to the director of a research department, or we can go to the head of university and speak with them directly. And there are no barriers.
There's really an open relationship here with also with our team, and it's really open talk with him. Not, you don't feel lower besides him. Yeah, exactly. It's really nice that you can feel on the same level, and that they listen to what you have to say. Where in many other parts of the world, it's not like that. Then you just if you're a student, then get away with you.
yeah, definitely.
So that's something I really love about being in Denmark.
How do you interact with pharmaceutical? I mean, the government and the resources that are on the table. I mean, how do you see that pharmaceutical industry here works? Who has the most power?
Right, it's a good question. So you're essentially asking about the power of the private sector versus the government. So in Denmark, the government really has a lot of the upper hand. And so for instance, when I work in drug development, so when we have drug in trial phases after phase 3, when drugs have to be implemented, then we write long reports about all the details and everything that we do, and we send that to the government. The agency, which is kind of the equivalent of the FDA in Denmark.
No, I know it was one of the background job that I have.
Okay, nice.
So I know, but people don't know.
Yes.
So okay.
Yeah. Then they go through everything, and I mean, a lot of the people in our department and other departments, they have regular meetings with the government agents about this drug that we are working on, and they're really, really strict, and the sector is heavily regulated. So it's really, it's really quite difficult, I would say, in Denmark to get away with something. If you wanted to sell a drug that where you have your predictions, but your predictions are based on faulty models and so on, it's really difficult to get away with that, because in government the system is designed that you really have good experts that are reviewing the work that we're doing, people who are at PhD level or beyond PhD level, who can sit down with us and talk about all the details. Where it's not something fluffy on the surface, and they really can't get into the details because they don't have the technical skills. So I would say in many cases we meet people who have the technical skills.
Here, the regulatory authorities are even more competent, or even more, way much better, with a better knowledge.
Yeah, I would say in some cases that is definitely true. In other cases, it's I would say that there are also countries who are equally competent. So if we look at the regulatory affairs of, let's say, Switzerland versus Denmark, then it's pretty much equal. Then not much of a difference. But I would say in Denmark, the regulatory affairs have a good balance of flexibility and also kind of strictness, because a lot of the things, the people that need to be hired in the department, in many cases they must take several courses, they must have extensive training before they can do kind of the work that we do. And in many cases, people who get in, I can speak only for my department, I don't know about the others, but people who get in, either they get in when they're students, so they work 2-3 years in the company, or it is people who have like a master's in that specific area or a PhD, and then they get in. So it's really highly specialized, and the government requires that it's highly specialized people, and the programs that we are using, they're all kind of they must be approved before we can do any kind of use any kind of program for doing the research that we're doing. So I would say in those cases it's really good, and also the government has a lot of power in terms of negotiating with pharmaceutical companies about drug prices.
If we take a look at this chart, when reports talk about social benefit costs of mental health, they mean money spent outside hospitals, something as paid sick leaves, disability benefits, early retirement, and income support. So, in a welfare state like Denmark, mental health often costs more in lost work and long-term benefits than in treatment itself. Then there is a difference between the number of psychiatrists and psychologists, and this is another important point to highlight. Besides their specific roles, psychiatrists are the only ones qualified to diagnose and prescribe. Seeing a high number of psychologists that is not matched by a similarly high number of psychiatrists is particularly telling. Even more striking is the fact that the total number of psychiatrists remained virtually unchanged over an entire decade, from 2009 to 2019. Let's say that you have some sort of sickness, you are ill, whatever, and you have the need of calling your doctor. I mean, what's the process?
If you're ill, let's say that you have some form of a throat infection. And it hurts like hell and you have a fever. So I've had several of those, so that's why I'm going out with those examples. So I first time I called the doctor, got the time the same day, some hours later.
The same doctor? You have always the same doctors?
There's a clinic with maybe 5-6 doctors. They know each other really well. They have a journal on me. And they can open my journal through my CPR number. So
I'm asking you this because in Italy, for example, we are associated with one specific doctor, and that's it.
You can what is it called? Request that doctor. But doesn't mean that you'll get him. That is that's like usually a clinic, and you can get into some. But usually you can request the doctor. But I go in and they take a swab. See if there's anything in my mouth. Can they see some form of pus in my throat? And then they say, okay, you have a bacterial infection in your throat. You have tonsillitis, that is called. They give me a prescription. I go to the pharmacy store the same way. Everything in one day, and then you have the medicine. And then you start the antibiotics. And then 7 days later, you're.
And if you have, for example, something a little bit more severe, I mean, that requires the hospitalization.
Like cancer, for example?
No, not cancer. I mean, not at that level, but something that you need to go to the hospital just for a 1 day.
Fractures or broken arms.
For example.
Then you can also go in the same day, but sometimes the waiting line is really, really long. They prioritize out from who has the most severe state. So if someone comes with an ambulance, then they'll get the first priority. So basically, if you sit there in the emergency department, you're just hoping that it's not going to happen. Someone is coming and needs surgery immediately. I've experienced that sometimes. Most of the times I've been lucky every time I've broken something. But once I was waiting for maybe 8-9 hours. That is how long you can wait. And then they have started to implement something new. During the day you can get a wristband. You can go into zoo, for example, and kill the time. So you have to go back on the planned time. But if there is an extension in time, you have to come in later. Then they'll call you and say it.
Many of the things that you said to me are, let's say, practically similar to Italy.
And I guess that's why we can also easily work across borders in Europe as doctors. But it's kind of the same system in many areas.
I thought that it works here. It works a little bit better.
That is the stereotypical vision of it.
That's the reason why I'm here. Just to prove that not all the things that mainstream shows to you are the reality.
Oh, it's definitely not. We pay a lot in tax, and we also have good services, but it doesn't mean, for example, as you said yourself, or you ask yourself, that we don't get medicine for free necessarily. Often we'll need some really good insurance
not that expensive. You have a good one too for what, 70 crowns a month or?
Yeah, exactly. I mean, 160 kroner, 1,600 per year, so that would be like 120, 30.
And then they're almost covered and everything, but still, it's not that it just goes through the tax. So.
Yes.
Yeah.
Yeah, I got it.
So it's.
And you are not mad.
But I think, yes, it could bother me, like, sometimes if you think about how many people who doesn't get treated how they should or are, like, they earned the right to, like, have that possibility when they pay taxes. But I think the system works a lot of the times. And it works in a way where it covers most aspects like right now. I think it could be better, yes.
We can get angry, and there's also many Danes are tired of the high taxes here and want to get them lowered. But I think that we're.
What's the percentage of taxes?
38.
Yeah.
38?
Yeah,
39%.
If you're working, you also have to pay an additional, I think it's an additional 10%, which is called the contribution to the working market. But it's just a tax. But it's just
another
taxation
tax
with the same name, with another name.
Okay, yeah.
So,
It's an extra tax. So I pay 47%, but then there's what is this Fratrag called in English? There's some of it that you'll get back. For example, if I drive long trips to my work and back.
They give you something in return,
and
just
you
because you had this type of
have
activity.
a general work return too, just for working. Monthly one. So you're getting something back.
But this is the bare minimum. I mean.
Yeah.
Okay.
You're still paying a lot. That's true.
Yes.
Okay.
Exactly.
So, but there's. It's not to say that it doesn't work, but as I can hear from you, if it's not much different, then it can be a bit problematic that we pay a lot in tax, and that many has problem with it.
Yeah, exactly.
Yeah.
I mean, probably, I don't know, maybe if we can compare one system to another system, one treatment to another treatment, here, I don't know, probably, let's say, yours is a little bit better than the other one, okay, but how that better? I mean, in which terms? I don't know.
I see your point, but I don't know how it is in Italy exactly.
No,
But I think it's the bigger image. It's not just healthcare.
No, sure. We are just talking about healthcare, but there's a lot of.
I can give you several advice.
Yeah.
And I think you can too. First of all, I think that goes for almost every country, because in many countries in Europe they don't speak English. So you have to learn their language.
Yeah.
And here people speak English, but when you're an English speaker, it suddenly has like a psychological effect that people are just pushing themselves a bit more away from you, the national in here. So it's always good to first start learning the language, because that also shows that you're more than interested in being here and you want to contribute somehow. So language, and then work.
Okay.
And then through your work, and if you have an education too.
But work, you mean coming here just by have the job position?
No,
already
you can
found
also
it?
come here and apply. You can also
Okay.
come and apply.
Okay.
But if
you have
you
have to have this willingness of finding something.
You have to show that you want to be here. I think that every country is the same on that matter. They want, if people come as foreigners and have to live there, I think most want to learn the language. Do you want to learn the language, and that you're interested in taking education and have maybe a job besides that, or just working. And that's also always what I've told my girlfriend and her parents. So if you just, these simple things are enough to build up a good impression of what you're doing here. So, but also the thing is, many internationals over the years, it's been an issue that also Danes do it themselves, but internationals will come here for the SU. You know, if you know what SU is. Yeah. And then they leave with it after. That's been a problem in Denmark for many years. And then they did something that wasn't quite clever from the government, was to say that
I don't remember, something that they took away some of the SU from the foreigners or something similar. They made some restrictions on it that made many foreigners leave the country, and now they need foreigners again.
Yeah, okay.
Yeah, that's something that I experienced too.
Okay, yeah.
So they removed that regulation anyways. But that's just the point to say that I think that Denmark in a whole has been a bit annoyed that people just came here to get the SU, take their education, and leave with their education again.
Okay.
They would like people to stay here and use their education in the country.
Yeah.
Yeah.
I would definitely say that the benefits by far outweigh the downsides and the issues that you might experience in Denmark in comparison to most countries in the world. I mean, you get a lot of opportunities if you show initiative and if you show engagement. I mean, also in terms of practical things, if you will get a really, really good salary. I mean, in comparison to France, for instance, the salary is much better. So there are definitely, I would say that if you want to move to Denmark, it's a good idea to first plan on coming here for maybe, I don't know, a couple of months to see how everything is. Because the thing with Danish culture is that it's not for everybody, just like any other culture. So if you enjoy the culture and if you enjoy the environment, then you're gonna get a lot of opportunities here. Okay. And there will definitely be challenges. But I would say that generally, from my experience, the people who have come to Denmark are generally happier than the places that they have been to before Denmark. I mean, I can't think of a country that has better work-life balance. So even in really, really like top companies or top government positions, you still have a really good life balance. And it's very rare that anybody is working above 45 hours. So, I mean, we do have some researchers and professors who are working way more than that, but it's not even that the position requires it, it's just that they enjoy doing it. So the Danish mentality, in short, would be that the Danes in general don't work to make money. They want to find what their passion is and what they love to do. And it's not about finding work for survival, but finding work for fulfillment.
Did you have any others? Yeah, I was thinking if you had any other participants.
Participant? No, I'm just standing with a card box and hoping that someone,
how long?
stand 1 hour more or less.
All right. Yeah.
So now you know why. Now you know why people are not just coming directly and saying, yes, let's talk.
Exactly.
Yeah.
It's fucking freezing.